Finally, this question that was completely appropriate around the county and the partnership agreement and all of it. Let me just go into slightly more detail. We are at the beginning. We are at the beginning, and the question is: the county sending their mental health workers to these two projects is a completely appropriate one. And I think the answer probably is not as much as we need at this point. Okay, we can get mad, which we're not going to do, or we can commit ourselves with the county to implementing this agreement over time in a way that is real and meaningful. What does that mean? That over time, as we build out more beds, as they build out their mental health, the number of mental health clinicians, for example, and the health plans under the partnership agreement provide their resources for outreach workers, that they are in each of our shelters and our tiny home projects. That must be the way that it is. Remember that the agreement, it's my new button, WIT, whatever it takes. That's the legal standard. It is the standard, whatever it takes. The county is required to add as many full-service partnership slots under the Mental Health Services Act and or provide whatever level of care is necessary for people who are not only in the encampments, but are in our various parts of our shelter system. So we don't expect miracles overnight, and there is real workforce challenges and workforce issues that we're building up. But over time, this is exactly what we have the right to expect, so that everybody is cared for. And that's the foundation we have laid together. And finally, more beds are coming. More beds are going to come through the state. More beds are coming because of the partnership agreement and our collaborative approach, including the Housing Authority with projects in South Sacramento, Stockton Boulevard, as we know, and other places. The private sector is now getting interested in potentially providing beds. A lot is happening. And the partnership agreement is the core of it because it defines roles and responsibilities and legal obligations we need to follow through. This shows, this report and what you have done, that homelessness need not be hopelessness and that more people can get the help that they need and deserve. Thank you.